Okay, if you're a dog owner, especially if you have a little guy, this is one of the most important things you could learn about their health. We're going to talk about the single most common heart disease in dogs. But, what's really exciting is that we're also going to talk about new ways to manage it that can give our best friends more and better time with us. So let's just dive right. So, to start, just how common are we talking? Well, this condition, myxomatous mitral valve disease, let's just call it MMVD, it's way easier. It accounts for a whopping 75% of all heart disease cases in dogs. I mean, think about that. If a dog has a heart problem, the odds are really, really high that this is what's going on. So what is MMVD exactly? Picture your dog's heart. It's got a super important one-way door between two of its chambers. That's the mitral valve. And its job is to snap shut nice and tight every single time the heart beats to keep blood moving forward. Well, with MMVD, that door starts to break down. It gets kind of thick and bumpy, and it just doesn't close all the way. And that creates a leak, right? Blood starts flowing backward, which forces the heart to work so much harder to do its job. Now, while technically any dog could get this, it's got a really strong genetic link. We see it, overwhelmingly in certain small breeds. Cavalier King Charles Spaniels are kind of the poster child for this disease. They often get it younger than other breeds. But Dachshunds, Poodles, and honestly, most small dogs are at a much higher risk as they get into their senior years. One of the trickiest parts about MMVD is that it's a super sneaky disease. It starts silently. Vets use a staging system to keep track of it, and the very first stages, A and B1, are all about what's happening on the inside, long before your dog would ever show you that something is wrong. Let's break that down. A dog in stage A is simply at risk. So think of any young, perfectly healthy Cavalier. Their heart is totally normal. The big change happens when they hit stage B1. At this point, the valve is leaking just enough that a vet can hear a heart murmur with their stethoscope. Now your dog, they still act completely normal. They're playing, eating, sleeping, no clue anything is different. But that murmur, that's the very first sign that the disease has started. And this is exactly why those yearly vet checkups are so critical. And that really just hammers the point home, right? This isn't something you're going to spot at home in the early days. It's a disease where you have to be vigilant. Your vet's stethoscope is literally the first line of defense, catching that quiet little whoosh from the leaky valve, sometimes years before it ever causes a real problem. For a long time, the advice for a dog with a murmur but no symptoms was basically just to watch and wait. But this is where the entire story has changed. Thanks to some incredible research, we've identified this new critical turning point, stage B2. And this stage is a huge opportunity for us to step in and actually do something. This was the question that vets and researchers obsessed over for decades, right? They could hear the murmur, they knew the heart was changing and working harder. So wasn't there something, anything we could do to help the heart before it started to fail? Before all the coughing and the breathing problems started? And the answer, based on some really solid science, is a huge, resounding yes. The 2019 guidelines from the American College of Veterinary Internal Medicine were a complete game changer. They confirmed that there is a very specific moment in time, before any symptoms show up, where starting medication makes a massive difference. So how do they find this exact moment, this stage B2? Well, it's not a guess. It's all about the data. They look for a few key clues. First, the murmur isn't so quiet anymore. It's gotten louder. But the real proof comes from looking at the heart with an ultrasound or an echocardiogram. They're looking for clear, undeniable signs that the left side of the heart is getting bigger because it's straining from that leak. They take these super precise measurements, and once those numbers hit certain thresholds, bam, we know we're in stage B. And this is what they're looking at. This is an ultrasound of the heart. The vet can see the chambers moving in real time and can measure them with incredible precision. Those measurements allow them to say with total confidence, okay, the heart is officially working hard enough now that it's time to give it some help. And here is the absolute key takeaway. When a dog hits all the criteria for stage B2, starting a medication called pimobendan has been proven, scientifically proven, to delay the start of congestive heart failure. We're talking about, on average, giving a dog about 15 more months of a happy, symptom-free life. It's amazing. The drug just helps the heart pump more efficiently and relaxes the blood vessels, which takes a huge amount of strain off that overworked heart. Okay, but what happens when the heart just can't keep up anymore, even with that help? Well, that's when a dog enters the later stages, C and D, and develops what we call congestive heart failure. Now, this is the scary part every dog owner worries about, but it's really important to note that this is a condition we can manage. Honestly, the best way to think about congestive heart failure is like a plumbing backup in your house. The heart's a pump, right? And when it can't push blood forward like it's supposed to, the pressure builds up behind it. That pressure eventually forces fluid to leak out of the blood vessels and fill up the lungs. And that's what causes those classic signs we worry about: a cough that's often worse at night, fast breathing even when they're just resting, and a dog that just gets tired out way too easily. So when heart failure is diagnosed, it's a big shift in our thinking. The goal isn't really about stopping the disease anymore. It's about actively managing all those symptoms to keep the dog feeling good and comfortable. It's absolutely not the end of the road. It's the start of a new plan that's all about quality of life. And to do that, vets have a whole toolkit of medications, and each one has a very specific job. Furosemide is the star player. It's a diuretic, you might know it as a water pill, and its job is to pull all that fluid out of the lungs so the dog can breathe easier. We keep using pimobendan to help the heart pump strong. Then, we usually add things like an ACE inhibitor to relax blood vessels and spironolactone, which blocks hormones that make heart failure worse. It's a real team effort. You know, the official guidelines also point out something else that's super important: nutrition. A really serious complication in late-stage heart disease is something called cardiac cachexia, which is basically a fancy term for the body losing muscle. It makes dogs really weak, and it's a bad sign. That's why keeping them eating and maintaining a good, strong body weight is just as important as the medicine. Because believe me, it is so much easier to keep weight on them than to try and get it back once it's gone. So we've gone through a lot of information. What does it all really boil down to for you and your dog? Well, it all comes down to one thing: partnership. This is not something you have to figure out on your own. So let's just recap the biggest takeaways here. 1. MMVD is super common, especially in little dogs, and it always gets worse over time. 2. Those annual vet visits are not optional. They are your absolute best tool for catching this early. 3. And this is the big one, we have this incredible window of opportunity, stage B2, to start medicine before our dogs even feel sick. 4. That early treatment really, really works. It can buy you a significant amount of extra happy time. And finally, even if you get to the later stages, a close partnership with your vet can make sure your dog has a fantastic quality of life. So I guess the only question left to ask is this: if you have one of these at-risk breeds, or any older dog really, when was the last time someone had a good listen to their heart? The whole point of this explainer is to give you the power to be your dog's best advocate, and having an informed chat with your vet might just be the most important conversation you ever have for them.